This treatment, using this very specific bile acid, has been used for hundreds of years in Asia. It's been used by the American Indians for various purposes. I'm going to talk about the benefits of something called TUDCA. What does it stand for? Well, it's a very, very long name for a very specific bile acid. It's used for treating gallstones, because a gallstone is a lack of bile, and it's a super concentrated cholesterol stone that can be dissolved when you add more bile. Also, this type of bile acid is used for liver cirrhosis because it inhibits fibrosis, which is scarring of the liver. So anyway, it's a really great ingredient for a lot of different things, especially if you tried everything and nothing's worked. Try this because it's very, very effective at a lot of different conditions. Let's just talk about what it can do. It can help you thin your bile. Many people have a situation where their bile is too thick, and they might not develop a stone, but they have a lot of pain in the right lower quadrant of their abdomen. So they have a lot of congestion, bloating, and that can create pancreatitis. It can create a whole bunch of issues because the bile then backs up into the liver, and it's a detergent. So it's very, very irritating to the liver tissue, and that can cause pain and shoot up to your right shoulder blade and up to the neck and create headaches, create a whole bunch of problems. Now, also realize that where the liver is located on the right side, when it gets backed up, it can put pressure on the heart. It can put pressure on your lungs, so it can affect breathing. It can affect the heart. It can create palpitations and even arrhythmias by having the liver being a little bit too swollen, and because there's just not enough space in that area. So there's a lot of benefits to the heart by taking this TUDCA. I recommend the dosage to start out. If you have a major problem, take 2 on an empty stomach in the morning and take 2 in the afternoon on an empty stomach. But if you take it with food, it's going to help you digest the food. There's been a lot of research in the past and ongoing research on the eyes, on retinal degenerative disease, on various problems with the eye, on improving visual acuity. Why? Because bile helps you break down and absorb vitamin A. And there's a lot of other reasons why it helps the eye as well. It's been shown to improve symptoms of Parkinson's disease. Why? Because it's neuroprotective. It seems to help the neurons in your brain. It has very good anti-inflammatory effects, especially of the liver. So if you have any liver problem like cirrhosis, hepatitis, or a fatty liver, this would be a good thing to take. It can decrease fibrosis, which is very cool. It protects the brain, I already mentioned that, and it can decrease plaquing of those beta amyloid plaques in the brain. Very cool. It can support insulin sensitivity, so if you have insulin resistance, it can help with that condition. It can make insulin more sensitive. So for a diabetic, it's really good stuff. It supports the gut lining. If you have leaky gut, or there's some permeability issues, or there's food that's getting into the pores of your intestine, this would be a good thing to support that condition, especially if you have like inflammation of the colon itself. It helps protect the kidney. So as you can see, it does a lot of things, and I just scratched the surface.